Ladies, today we are going somewhere that the Slayer Day podcast hasn't gone before. Get ready to dive into hormones, sexual health, and all the things that you wish you would have learned in your sex ed class. Help me welcome to the Slayer Day podcast today, Dr. Kelly Casperson. Kelly, welcome to the show.
Hi, thanks for having me.
Thanks for being here. I'm excited to dive in this. Like I mentioned in the intro, this is a topic or topics that we haven't really dabbled into in this Layer Day podcast. So I'm excited to have this conversation. And I think it's something that we really, really need as women, especially as high performers, because high performance health is one of the main categories that we talk about here on the show.
I love it. It's so important. And I don't think we don't get time enough with our doctors or, our midwives or whoever to actually understand what happens to our bodies at this point. And so it's so good to have like this long form content where we can actually like dig in.
Yes. Well, I just want to have you do a little quick intro so the audience can get to know you. You are a physician, but you're also a urologist. So I would love to have you give us just a quick little background so the ladies can get to know you.
Totally. So I went to medical school and didn't know anything about surgery, being a young female, not a lot of surgeon role models, but fell in love with urology. Urology is a surgery subspecialty of the kidneys, the genitalia, the bladder, prostate in men, external genitalia in women. So fell in love with it and never looked back. So about 5 years ago, I was kind of like, you get kind of comfy in your career and a little bit bored. And I had a patient basically come in and change my life because she needed help with sexual dysfunction. And I didn't know how to help her. And so I was taught that women were difficult, we'll never understand them. Don't worry, the gynecologists are taking care of them. Like all of these things I was told in my training. And I was basically like, is it true? Right.
Mm-hmm.
And then really started to deep dive onto female sexual health. And via that pathway got into hormones because I'm like, why is everybody so scared of them? Why do people not know? Why do we not know what happens to our bodies? Right. Just because we can't see it doesn't mean a profound change doesn't happen in midlife. So kind of got into hormones via sex is what I joke about and love talking about all those things.
I love it. Well, I want to start there. I want to start with hormones, on the topic of hormones. And so at the time of this recording, I'm 36. My birthday is Sunday, so I will be 37 on Sunday. And I've had, thank you. I've had 2 babies, and I already I was joking with my husband the other day I was like, oh man, because I'm lifting heavier in the gym. And I'm like, I'm gaining some weight. I think it's my hormones. And he started cracking up. I was like, but I'm serious. So I want to talk about hormones and hormonal changes in our 30s. So what are some common changes that women can experience in our 30s? Because I think we don't think about maybe like menopause or hormones, maybe until 40s or 50s. I think that there's like so much misinformation around this. So how can we get a better look and understanding at this for hormonal changes in our 30s?
Yeah, I'm so glad you're bringing it up because I think so many women are like, when I think of like, I close my eyes, I think of like what a hormonal woman is, like a 70-year-old with white hair and like the Golden Girls comes into my mind, right? And I know the data. So like we have this stereotype of like, that is way over there. And like, we do not even need to think about it. But average age of menopause and how we define menopause is no more natural periods. Right. Mm-hmm. Which is tricky because a lot of us have ablations or IUDs or hysterectomies. So it's a goofy definition anyways in modern times. But that's 51 is the average age of no natural periods. And what that average means is 50% of people happen before, 50% of people happen after, right? But then there's perimenopause, which just means the years surrounding menopause. So let's say your menopause is going to be 45. We don't know. Right? We don't have a test to predict the future, but the years leading up to that can be fraught with hormonal ups and downs and ups and downs. And that's what people don't understand. They just think it's your periods ending and not the reverse puberty of kind of things going offline. So in your later 30s is a very reasonable time for some people to be experiencing perimenopause. Now, there's no test for perimenopause. You can't go in and be like, can you check and tell me? Right? But it's really for people who are hormone experts, it's listening to your story, hearing what you're saying, and then sometimes using labs to confirm things if we don't want to guess, and also ruling out other issues, because it could be a thyroid issue, it could be prediabetes, all these other things. So really
Sure.
having hormones be in the picture. But
Okay.
commonly women will say, I went to my doctor, they said nothing's wrong with me, all my labs are normal. But if
Yeah.
you're having symptoms, to me, I'm like, that's perimenopause.
Right. So what can you give us some of those, maybe some of those things to look for? I think that, again, knowing that there's probably such a wide range of things to look for, what are maybe some of the more common? I mean, you told us kind of an age, but what are some of those symptoms? What do they look like?
Trouble sleeping, waking up, not being able to sleep long, not getting deep sleep, more anxiety, more moodiness. The rate of depression in perimenopause, you have a 40% increased risk of depression in that midlife perimenopause, because we call these sex hormones, right? These are body hormones, and estrogen, testosterone, progesterone, which are kind of three most common ones that we actually have medications for. They work in our brain, and the brain's very sensitive to changes in hormones, not just what the levels are, but how they're changing. So in that perimenopause, when things are changing a lot, the brain's very sensitive to that. We can see more migraines, more headaches, more moodiness, trouble sleeping, joint aches and pains, dryness with sex, having to pee more. Lots of different things which you will never associate with your periods, and you're never going to
Right.
associate them even with this, what we call the sex hormones, which I think is a misnomer, because these hormones work everywhere in our body.
It's so crazy because you're saying all these things, and I guarantee every single woman listening is like, I have that, I have that, So it's almost like, you're not sleeping well. That's a symptom. Like so many things. And I've listened to other episodes of you talk about this topic as well. And I'm like, man, there's so many things that uh you can contribute to that. But it's like, I think that being on top of it and really knowing your body is going to be such an asset to you as kind of the hormones, fluctuate as we age. So, like, what would you say to someone that is kind of now this is on their radar for them to, now you've mentioned a few of the symptoms. What can we do to be proactive?
Yeah. So healthy body, healthy perimenopause, right? As much as we can. So exercise, sleep, going to bed at the same time, trying to have good sleep hygiene, healthy diet, really looking at the relationship with alcohol and drugs at this life, because our bodies are getting less and less good at processing those things. And so
Mhm.
people are like, I used to be able to have 3 drinks and I'd wake up and I'd go to the gym. It's like, you can't do that anymore. So,
No.
maybe it's best to kind of think of cutting those things out, or at least down, is
Yeah.
really as healthy a body. Smoking, for anybody who's still smoking, because people are, is horrible for your ovaries. When we talk about ovarian health, smokers have on average a 10-year earlier menopause than
Ah,
non-smokers. That's like the
that's
biggest
reason
no-no.
enough to cut it out.
Yeah, for ovarian. But then everything else that's good for the body is good for the ovarian function. Because it's something
Mhm.
we've never talked about. How do we get our ovaries to give us a couple more years? We are in our infancy in looking at, people. There are researchers looking at that, but
That's
like most of
incredible.
us don't even think about that.
So let me ask you this. How closely linked are mental health and sexual health? Because it sounds like there's a really deep connection between the two.
Yeah, absolutely. I mean, libido is a mood, right? If you think about sex drive, libido is a mood, that's a brain. And so anything, if we have more anxiety, we're not going to be in our body, not going to be in the present moment. Depression.
Mhm.
The medications for anxiety and depression they have tons of sexual side effects. And I guarantee you, most people aren't being told about that. Or if
Yes.
they are, they're like, well, it kind of brushed off that your sexual health is important, not only
Right.
for your health, but for the health of your relationship.
Yeah.
Right. So a lot of sexual side effects especially with the most common antidepressants, the SSRIs, low
Mhm.
libido, inability to get aroused, trouble having orgasm, a whole host of those things. But the
Wow.
healthier your body is, the healthier your mind is, the better the sex is. Not for everybody. I'm like, I don't want to overly generalize everybody. But again, the better you're sleeping, the more libido you have because you're not
Yes.
exhausted, right? So
Yeah.
so many people I think sex exists in a bubble outside of their body and mind, but really it's an integral part of your life.
Yeah, it's so funny because my husband and I we have weekly date nights, and I always tell him, I'm like, communication is such a huge part of that for us, for the date night and then like after the date night. And men, I mean, my husband, I'll speak for my husband, you know, he likes the physical touch, he likes the hand holding, the touching, and I'm like, but I need the communication
Yeah.
part of that. So it's so true where you're like, I need, and I know for, look, if you have kids, especially if you're in that beginner stage where you maybe, you know, newborns, the kids are sleeping in your bed, because that's us right now.
Mhm.
It looks so different than we call, like, even like before we were married, like when we were dating, because you're not sleeping. I mean, we're getting kicked at night. Things look so different. So what can you say for the woman who's kind of in this stage right now, where we know how important it is to have the communication, and we know how important it is for mental and physical health. What would you say to the woman who's listening, who probably isn't getting a lot of sleep, who's in this just season right now? How can we support her?
Yeah. I mean, the first thing to tell her is you're not broken. This
Hmm.
this is oh, I don't want to use the word chaos, but like there's a lot going on, right?
Yeah.
And just like sex doesn't exist in a bubble, right? The conditions have
Yeah.
to be right to have a good sex life. And I think it just comes down to us not being educated on it, not telling people like, hey, in relationships, your sex life will have phases. It'll come,
Hmm.
it'll go. It doesn't mean
Yeah.
that if it's low right now, it's never going to come back.
Yeah.
It just means like right now your body has other priorities. It's trying to heal still. You know, a
Yeah.
lot of women don't know, like, especially if a C-section, like surgery takes a year to heal. Your pelvic
Yeah.
floor takes a good year to heal. And just
Yeah.
understanding that, because the myth, you know, you get your 6-week postpartum visit, they're like, you're good to go. I was actually talking to some gynecology friends. I'm like, where did this you're good to go at sex at 6 weeks come from?
Yeah.
Like, do we have data?
Right.
No, not at all. And so I think even that's like an undue pressure of being like, you're
Sure.
fine, you have a blessing. And like bodies are not ready. We're
Right.
just not ready. And I think understanding the science and understanding like, oh, bodies aren't ready instead of like,
Mhm.
I need to be back. I need to be have it how it was. I
Yeah.
like this new life in your life isn't affecting you at all.
Yeah.
Right.
I mean, I
But no, like
remember.
sex lives will come back.
Yeah, yeah, they will, they will. And I, you know, it's funny because like we were talking a little bit before the show, and I said, wait, I want to save this for, you know, when we record, because I think it's so important to let women know that that is a season. I mean, I had 2 C-sections, and it was so hard, not only because I had major surgery, but I was breastfeeding. I couldn't even get up out of bed. Like, I remember my husband having to like literally get behind me and help me sit up. And then I was trying to like get back to working out. I'm like, why in the world, like the pressure that we
Mhm.
feel as women to like get our bodies back and like get back to work and get back in the gym is insane.
It's insane. Yeah, I was working out today and a woman's like, she's 4 months postpartum and she's on this workout program where she has to work out twice a day. 4 months postpartum. And I'm like, that is not a congratulations. That is like
No.
headed for burnout and to
Yes.
hurt yourself. And
Yes.
like, you know, your ligaments need to heal. The hormones are a plane wreck right
Yeah.
after that. And so it's really like giving women of like, dude, you just created a freaking life
Yeah.
that is unbelievable. Like things will come back, but you got to give it time. And I think it's that pressure women put on themselves.
Mhm.
If I
For
could do
sure.
anything, I would take that off first. I think as
Yeah.
far as the sexual relationship part, guys, if you're partnered with a man, guys don't understand what your body went through. You have to
Mhm.
explain it
Right.
to them.
Yeah.
And to what you said, a lot of guys find intimacy in physical touch. And dude, you're
Mhm.
touched out. You if you're breastfeeding, you got this baby all the time, you can't put down, like you're touched out, and
Yeah.
another burden of more touch is actually kind of a turn off, right?
Yeah.
And but you got to communicate it, right? Cuz you don't
So
want
good.
them to feel rejected. So it's exactly what you said.
Yeah.
Communication goes so far
Yeah.
in feeling heard, in understanding where you both are at.
Yeah. It's so good. I mean, I think that's the one thing that my husband and I always come back to, because for me or for him, if we're not feeling like seen or heard or touched or communicated with, we're like, what's missing? Oh, we need our communication back. We're like, if he's traveling or I'm traveling, it feels like you're just like not on the same page anymore. And for everything in our relationship, when we can communicate, it's like, boop, that's the magic trick.
Totally. Yeah, like, I've been married for 15 years and like I'm still figuring it out, but it's like when you can actually say, I don't feel connected right now, I want
Yeah.
to work towards getting connected, like game changer. So you're
Yes.
like connection actually, it's not a default state, especially if you're working and have kids and
Yeah.
are traveling, of like you have to work to be connected to somebody.
Right.
And like communicating that, especially for people, tend to be women, but I don't want to stereotype, who need to feel connected in order to want to be sexual. Right? If the connection is not there, you're like, no, this is not going to work. Whereas other people have used sex to get connection.
Right.
And communicating that, because usually those people are like in a relationship together in the same house and they have no idea.
Exactly.
Yeah.
So, okay, so let's talk about that for a second. So what would you suggest that, for, let's say let's call them love languages, right? You have two partners that have different love languages. One's physical touch. In order for them to feel loved, they need that physical, but the other one is communication, talking, expressing feelings. Like, how do they get on the same page in order for them both to, get to that point of having sex, being physical, so both parties' needs are met?
Yeah. I mean, we all think we're mind readers and we're not, right? We have no idea what's going on in the other person's head.
Yeah.
And really it's the communication of like what I've learned about myself is I need to feel connected in order to be intimate.
Yeah.
Right. So I need to get connected before we are intimate. I want to be intimate, but I need to get there. Right. And connecting that instead of just saying I'm rejecting you because I'm not connected right now. Right. And so it's kind of this bid for connection. And same with the person who likes the touch, right? Of like, say that. And what other kinds of touch are acceptable to you? So it's not always the same sort of actually sexual touch. What else can be fulfilling until your partner gets there on the same page as you?
That's so good. And I want to ask another question about this. So a lot of times stress plays a big role in the reason why we're like, oh, I'm not in the mood, or I'm so tired, or whatever. So number one, how does stress affect our sexual health? And then are there any strategies that women specifically can use to maybe manage stress more effectively for a better sex life?
Yeah. So we have basically two different types of nervous system, right? We've got our sympathetic nervous system and our parasympathetic. So sympathetic is the fight or flight, tiger's chasing you, go, go, go. That is your average day in America now. Because it's like, you got 40 things on your plate. Kids got to get to school. Lunches need to be packed. The house is a mess. Blah, blah. I got to get a workout in, whatever. So like you're go, go, go. You got cortisol all the time. Sex thrives in the relax, rest, and digest, or the parasympathetic, right? That's where the orgasm lives. That's where sexual pleasure lives. So you can't get there with the same nervous system you use to like run a big business.
Yes.
Right?
Yes. So oh my gosh, you're speaking to our audience right now. That is the women that come here were like high performers in alpha mode all the time. So it's so hard to shut that off. I'm speaking for myself right now.
So hard to shut it off. And that's the skill, is realizing your best sex life probably doesn't. It does for some people. Some people, sex is a stress relief. But for a lot of other people, they're not interested in having sex when they're in that go, 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 fight or flight state. It is really learning how to change your nervous system. What do you need? Because so many people are like, I'm not in the mood. But then you learn, you're like, I could get in the mood though if I could have like 20 minutes, maybe some yoga, maybe a bath, maybe just me alone with some erotica in bed, maybe me pre-gaming with a vibrator and some lube, maybe just sitting on the couch and having a conversation, maybe watching comedy, right? So like everybody's got a different thing that can calm their nervous system down and put them in a more accepting, relaxed state.
Yeah. And I think that it's so funny because at nighttime, I'll get ready for bed. You take your shower, you wash your face, you do the whole thing. My husband's like in and out in like 2 minutes. I'm like, I need the wind down. That's the thing that helps me like wash off the day, And also what I find too is like, I used to wear this might be a tip that like I'm just stumbling upon now, but like I used to wear like the frumpy kind of like Victoria's Secret lingerie, and
Mhm.
now I'm like, he's like, I really like it when you wear those silk pajamas and so I'm like, oh yeah, I forgot. Like I did you wear those once upon a time. So I went back to that.
Totally. Yeah. It's like what makes you feel good, right?
Yeah.
And good on your partner for being, for communicating like, "Hey, I think that this is really nice." And then you're like, "I want to do that."
Yes.
The
Yes.
other pro tip, and not everybody can do this, but it is a pro tip of like don't save sex till the very last thing of the day cuz everybody's
Mm,
exhausted. If
yeah.
you, it's harder with little kids. But
Yes.
like morning sex, afternoon sex, midday sex, like if you can if it sounds crazy to you, don't do it. But if you do save things till the very end of the day, you've given your energy to everything else. You're
That's
just
true.
tired.
So how do you feel about scheduling sex? Because I feel like that's something that we do.
Yeah, like literally all the sex therapists think it's a good idea.
Oh, okay. So we're
Like
pro scheduling
it's
sex.
it's pretty pro scheduling on the experts. The only people who
Okay.
don't do it, or who they'll be the like no to scheduling sex, is because if you make it feel like it's a burden, or you
Or like a
make it feel
job.
like it's your job, like you're
Yeah.
clocking in, right? Like, but that's more of your thoughts behind it than
Right.
like let's block and protect some time. It's no different than scheduling your workouts.
Yeah,
It's no different
100%.
than scheduling when your cup of coffee is going to be. Is like if it's important to you, you put it
Yeah.
in your schedule. And
Yes. And
going back is like good sex is not an accident.
okay, so let's talk about that. I like this topic. So how do we dive into having better sex? We talked about the relaxation part of this, but what other tips you got for us?
So the more that and we're talking a heterosexual relationship here, but the research done on women. So the more that the woman has pleasure or enjoys being there, the more she's going to be. This is like a no-brainer data, right? But
Yeah.
like sometimes it's good to go back to basics of like if
Yeah.
everybody's having a good time, everybody might want to show up more.
Right, right.
So really prioritizing like, is this for the we of the couple? Or
Mm,
because when this becomes about one person or performing for one person, the
sure.
other person doesn't want to show up, right? And
Right.
feels kind of broken about it. So
Mhm.
really the we, this is us, this is the relationship, equal pleasure as much as that is possible. There's something called the orgasm gap, and that's
Oh,
looking at the difference in or using orgasm as a marker for pleasure. But in heterosexual relationships has the biggest orgasm gap. That means he has
wow.
an orgasm about 95% of the time. She has an
Wow.
orgasm around 60% of the time.
Oh my gosh.
Right.
Yeah,
And
that's
then
a
we wonder why
really
she
big
doesn't
gap.
want to show up to the party. Is like it's, it's more mushy broccoli for her than a steak and candlelight. So
Right, right.
really prioritizing like, and we all got to this point because our sex education's horrible. We
Yes,
still
yes.
exist in a society where female pleasure is shameful, right?
Right.
So like we come to this bad sex life very naturally, and we actually have to do
Yeah.
work to be like, oh, all bodies are capable of equal pleasure as easily as all bodies, right? And like
Mhm.
but we have to learn that, and to be like, oh, that traditional what you see on Hollywood as
Right.
sex is not actually what great sex is.
Yeah. It's so crazy to me too because I mean they're not teaching this in school because obviously they're there to teach you about like reproduction and how a
Mhm,
baby's made and the
mhm.
anatomy, right? It's
Yep.
not how to get pleasure or give pleasure. It's about, just the basics. And that's why, I opened this conversation up with this is not your typical sex ed class, right? This is so much more, I think, about being educated where we are today for ourselves and our partners because I don't think most people got that.
Oh god, no. I mean, I think back to mine, like my anatomy lesson of like it was ovaries and uterus
Right.
for the female body, right? Which is like not useful as far as a healthy sexual relationship with your partner whatsoever.
Yeah.
There are
Yeah.
so some European countries teach pleasure. And the other thing that we don't do, which we could be better at, is we don't teach communication,
Right.
right? And so
Yes.
it's like, man, why wouldn't communication come first before a sexual event, right?
Right.
So,
Right.
Yeah. So there are
Yes.
countries that are doing it better than we are.
And it's so crazy because I have, and I want to get your feedback on this as well, but I track on my phone my cycle. And there was an option. It was like sync up with your partner. So it was like, and I was actually putting it on my husband's phone. So I'm like, give me that phone. So I'm putting, my login to pair it up or whatever. And I'm like, this is so smart because not only does it track when your menstrual cycle is happening, but it's like, she might be feeling low energy today, or more tender breasts, or whatever it is. I'm like, this is so great because now
That's
he's seeing
genius.
the thing that I'm feeling.
That's genius.
Yeah. So that to me is like, that alone is worth, I mean, I don't even know how much I pay for it, maybe $10, I don't know. But whatever it is, it's worth it because I also am more in tune with my body. And then now my husband can see like what is actually happening or how I might be feeling, and at least know like kind of what's going on before he even sees
Yeah.
me.
Yeah. And the other reason I really like that is it takes the burden off of you for needing to communicate that.
Yeah.
Right? Of like, no, this is just the facts. This is just
Right.
where we are. That because in for people who don't know this, in the second half of your cycle, so after ovulation, our progesterone goes way down, the estrogen
Uh-huh.
goes down. Like it's those, and again, it's those changes in hormones that our body is
Right.
very sensitive to, which is why we can start noticing that.
Yeah.
So that's brilliant.
Yeah. And,
Link in
I've been
show
doing.
notes. Link in show notes for your people
Yes.
for that
Yeah,
app.
yes. Yes. I will definitely link that. And also, what I've noticed is I've been doing really within the last year a lot more research into my cycle, into my body, because the crazy thing is, and this also is linked and it shows me in the app, it'll say, you're feeling more energy today, or your libido is up today. I'm like, oh my gosh, it is like, and the more I can recognize it, the more patterns I see. And then I'm like,
Yes.
man, like this is really informative to me because like I didn't really pay attention to it before. I was like, oh, I'm like, if I'm in the gym, why am I feeling off today? Why can't I lift as much? And now I know why. And it's the gym, it's libido, it's energy, it's sleep, it's everything.
That's sweet. I mean, I think that's a nice pro tip for people on libido too, is like women in our society have been conditioned to like, don't
Mhm.
want too much, be the object of desire, don't desire things. Right.
So
And then we
confused.
come along and we're like, I don't have a libido. And it's like, you were literally told your whole life not to be sexual.
Right.
Right. So like when we're trying to look at like, how do I get my sex drive kicked in? How do I have an interesting, active sex life? Is like, you do
Mhm.
have to think about those things of like, what do I like? What does
Yeah.
turn me on? And for an app to be like, hey, maybe thinking about sex right now, you're like, oh, right. I'm a sexual person who wants sex in
Right.
her life. Thanks for the reminder.
Yes. And I think also this is a really big topic I want to dive into is sex life after becoming a parent, like knowing that you are still a person. I mean, just because you are a mom now, or even let's just say now that you're married, like whatever that new transition is. But I think like
Mhm.
for me, and again, I'll speak for myself, the biggest transition for me was going from we'll say single, which was like married, no kids, into married with kids. And it was like a whole new world. I was like, who am I? I have to now like figure out my new normal.
Yep.
So that in and of itself is like, it's okay to be like wife, or let's say mom mode, wife mode, but also be sexy with your spouse or your partner, your husband, whatever.
Mhm. Yeah, totally. And back to the people who have the really littles at home right now of like, you don't have to be everything right now. You're trying to keep a human alive, right?
Right.
Like there's a season and
Yes.
sleep is awful and your hormones are in the toilet, right? Like give yourself
Hmm.
some time for that to come back. And then
Yeah.
when you are rested, you can be like, okay, I want to prioritize my sexual relationship now. I want to
Yeah.
reconnect with my partner because now that I've kept this baby alive, like it's time. So
Right.
to know that there's seasons, because I think,
Yeah.
that you go to the doctor and they're like, you're good to go at 6 weeks. And you're
No.
like, I'm the broken one, instead
Yeah.
of being like, no, this is chaos right now.
And
Just
it's hard. And like
keep the baby
knowing.
alive.
Yes. And like knowing it's okay that it's this season, because I think that many people we look on social and you see these beautiful pictures and images, but really she's like crying in the bathroom floor because
Right.
breastfeeding is hard and she's not sleeping and her hormones are all over the place.
Yeah. And, and also the people, it's not so great that we have this, paparazzi taking pictures of these people who just have babies, but like they have a ton of help, by the
Yeah.
way, right?
Yeah.
Like they've got tons of help at home to
Yeah.
look like that and to fit
Yeah.
in, to find the right pair of Spanx for 6
Right.
weeks
Right.
afterwards. But it's like most people don't have all that help. So don't
Yeah.
compare yourself to somebody else's,
Yeah.
life, which might actually just be shiny pictures.
Yeah.
Crying in the bathroom.
That's
Pictures.
right. Exactly.
Yeah.
So let me ask you this. How can women boost their sexual self-esteem and maybe body confidence, whether they're in that season or maybe they're not even in that season at all and they're just like, I need a little bit of a boost and a sexual self-esteem boost?
Mm-hmm. Yeah. I mean, again, I think communication with your partner is key. And so number one on that, because it's like, we think people, our partners are judging us, or if I can't let my partners, dude, they do not care. They are just happy to be there with you. Like, and like, it takes so much pressure off of the women of like, dude, you are your own worst critic. Literally
Yeah, true.
nobody is judging you like you're judging yourself. And if
Mhm.
they are, like, maybe don't be with that person, because most
Yeah.
people aren't. They're just happy to be there. They're happy to be at the event.
Right.
So like
Right.
taking the pressure off of like, I heard this the other day, and I thought it was so brilliant, of like all the sex that we've ever seen, whether it's erotica or whether it's just Hollywood or
Mhm.
whether it's what, any sex we've ever seen has been a performance for us to watch. And we
Gosh,
take
yes.
that into the bedroom and we're constantly judging how does it match up to these fake performances
Oh,
we've
it's so
been.
true.
And it's like once you realize like, oh, everything like Tom Cruise and that's a performance,
Right.
right?
Right. Oh my gosh, I've never even thought about that before. That's so true.
It was like, it struck me of like, oh, no wonder why we're so judgy of ourselves, is we're trying to
Right.
match up to this like curated performance, basically, right? Of
Right.
realizing like
Oh my
sex is messy, bodies jiggle, you need more lube, like you need to take a sip of water, you
Yeah.
got a Charlie horse, like that's what sex is. But like
Yeah.
people don't know that.
Right. Because we're just seeing this pretty produced thing on a screen when you're like, that's what it's supposed to be. When you're like, that's not even real.
It's a performance.
Yeah. Oh, that's
Yeah.
so good. I mean, that's a great reminder. Well, okay. So you mentioned lube. We mentioned performance. I want to talk about that for a moment. Again, whether it is postpartum after you've had babies or in the perimenopause or menopause stage, I want to talk about lube. I want to talk about any kind of products that you recommend that make the experience a little bit more pleasurable.
Yeah, totally. So postpartum and perimenopause, menopause, the hormone, your estrogen is very low. Especially if you're breastfeeding, you're making prolactin to make the milk, your estrogen is very low. So sex can be painful, it can be dry, arousal can be an issue. Anytime there's that low estrogen state, you can benefit by an estrogen product in the pelvis. Most commonly an estrogen cream. It comes in creams, pills, and rings. Cream's the cheapest. If your doctor can't give it to you or you feel uncomfortable asking your doctor about an estrogen product, an amazing online company is Interlude. Get interlude.com. It's only vaginal estrogen. That's all they do. So it's a good niche company. There's a couple other ones, because in this country it is a prescription, but it is a local estrogen cream. Think of like face cream. It's just skincare for down there.
Okay. Oh, I love that. That should be the tagline.
It should be. And it's incredibly safe. It does not go into your body. It does not affect breastfeeding for people who are breastfeeding. And it can make things much, much more comfortable because the tissue gets thinned and dry when you have low estrogen states. So my opinion is once you hit 50, if not earlier, all women should just start on a vaginal estrogen product to maintain the tissues. But again, going back to what nobody knows what perimenopause is like our pelvis is profoundly affected by low hormone states. But if you just think menopause is hot flashes, you're never going to think of that, right?
Right.
So that's just a skincare. Usually you use it twice a week and you use it, put it in before you go to bed. It's great. So that's for like for sexual health, but not during sex, right? Because
Okay.
it's just skincare.
It's like your
Um,
daily skincare routine.
exactly. You do a
Yeah.
mask twice a week. You do your vaginal estrogen twice a week.
Yeah.
Pretty simple.
So funny. Okay.
Um, it also helps your bladder, which is really nice
Oh,
because nobody likes bladder issues.
no.
So side bonus. Um, And then I would say, like, again, things sex ed never taught us is like the amount of lubrication your vagina and vulva makes is not an indicator of how turned on you are. It has a lot to do with hormones, just what your body naturally does. And lubrication helps everybody, decreases pain,
Mhm.
increases pleasure. Lube companies have done studies. The more, if you use lube, the more orgasms you have. So it's
No.
just, good for friction.
Better for everybody involved.
Better for everybody. If condoms aren't, in your life, then you get to use whatever type of lube you want because you don't have to worry about it being condom safe. So the oil-based lubes are lovely. Silicone-based lubes are long-lasting. Kind of this like cheap water-based stuff that's at the
Uh-huh.
grocery store is like the
No.
basic
Like a
and
no-go.
mostly I'm like,
Okay.
no, come on. Your sex life is more important than water-based lube.
Right.
Like,
Right. And
you
just like
deserve
you said,
something a
like
little
think about it like
luxurious.
your skincare, right? You're not going to just buy a cheap $5
Yeah.
skin cream. I mean, I hope not,
Yeah.
and same thing with your sexual health as well.
Yeah. I mean, the oil-based ones, I hate being cold. Being cold is not a turn on for me. And
Yeah.
like an oil-based lube, it's nice and warm. Like it's not like
Oh,
this cold, sticky, watery stuff.
yeah.
So try out,
Amazing.
and
Okay,
these things are not expensive. You could try a couple, find one that you like.
so are there any other preventative care measures that we should be taking, whether it's creams or like anything under that category that we should know about for preventative care measures?
No, I mean to me, I'm always like less is more. Get to basics, lube and vaginal estrogen, because I think women are
Mhm.
marketed to because of our
Yeah.
insecurities, because of our lack of
Yeah.
education, and there's so much junk out there that
Mhm.
anything that has fragrances or the things can be very irritating to the vulva. So I would actually say less is more. As far as
Okay.
cleaning, don't put anything in your vagina. Just soapy water in the shower, wash it off a little bit of the vulva. No scrubbing, no
Yeah.
chemicals or soaps, no specialty washes. Stay away from all of it. It's irritating to the tissues.
Yeah. So good. This is amazing. I think that, all of this information is, and first of all, it's always evolving, just like we are. I think that this is so important to continue this conversation and be on top of our sexual health because it is not something that we just turn on the TV and see or hear. So I think that doing your own research and being proactive about it is so important. So thank you so much for what you do. Is there anything else that you want to share with the ladies, and also, of course, share with us where we can connect with you and find out more about Dr. Kelly?
Yeah, thank you. So I mostly hang out on Instagram at Kelly Casperson MD. That's the website, kellycaspersonmd.com. The book is called You Are Not Broken, Stop Shooting All Over Your Sex Life. That's coming out pre-order right now on Amazon and Barnes & Noble, coming out in September. And then the
Amazing.
podcast is called You Are Not Broken if they want to learn more about sex or hormones.
Amazing. Ladies, go check out Dr. Kelly Casperson. This was just the start of the conversation. So make sure you head over there, check out her podcast, grab her book, and we will see you on the next episode. As always, go out and slay your day.